I'm sorry. Muroo is a real superstar in our program. She is president of our student nurse association, but she's part of many other organizations. Some of you may have met Muroo in the Center for Academic Success because she's a peer tutor there. She's part of the student leadership program. She's part of the peer mentoring program. You name it, Muroo has been part of the experience at Chamberlain. I think that is what we would love for all of you. I know many of you work, you've got children, you've got other things to do, but as much as you can take advantage of what Chamberlain offers, I would encourage you to do. But I want to call up Muroo now. She's going to give you her take on her experience when she went through this exact phase that you're in.
Thank you, President Snow, for that introduction. It is such an honor to be here today in front of you guys. Thank you for having me. I hope everyone's doing really well, as this is such a great milestone in your life. Because everyone, life is about moments. Moments that could change the way we act, speak, or think. Every opportunity, every day is a new moment. I want you to take a look around. Today, this transition of care ceremony is your moment. It is the day that you come one step closer to your journey as a nurse. So smile, give yourself a pat on the back, heck, high five your neighbors. You guys earned this. Yeah. There we go. You've already survived your first fundamentals exam. That deserves a round of applause on its own, guys. That was the first exam that really made you critically think. The first exam that taught you that there could be more than one right answer. Yeah, see the noise on that one? But which one is the most right? You've already survived your first lab, you've gotten signed off on your head-to-toe assessment, and you practiced more times than you can count introducing yourself to a mannequin. Hi, my name is... Can you please tell me your name and date of birth? But see, these are the moments that you will remember. When you go to your first clinical and you have your Chamberlain blue scrubs on, like the ones you're rocking today, your stethoscope, your ID badge, I want you to take a minute to remember this moment. The moment that you'll be able to walk into your first clinical with the word nurse in your introduction. So take pride in your accomplishment. The day before my first clinical, I asked one of my peers for some advice. And she told me, Muroo, do as many bed baths as you can. Wait, you want me to do what? You heard me, do as many bed baths as you can. Get as much experience as you can. For those of you that already work in a hospital setting, doing bed baths may seem like something you've already done before. But never pass up the opportunity to do something and practice in every clinical site. Prior to nursing school, I took a CNA course, and I had clinical in a nursing home. I did over 10 bed baths one day. But as a Chamberlain nurse, I never passed up the opportunity to do another bed bath. When you are doing a bed bath, you see everything, and I mean everything. But you also get to see the patient smile when they feel clean. You see them cry in your arms because they're lonely or afraid. You see them thank you for taking the time to give them a sense of dignity, for being their only visitor. When you give someone a bed bath, you get the opportunity to see and learn different patient conditions. No two bed baths are the same, just like no two clinical days. So make the most of every opportunity and every experience that you are given. Nothing is beneath you as a nurse. Sometimes as nurses, we get so caught up in all the little tasks that we forget the value of something so simple. Again, every opportunity, every moment is an opportunity to learn something. A quote that I live by, and a quote that has given me some remarkable opportunities, is the answer is always no, unless you ask. If you see a nurse carrying something interesting and she's walking this way, which way are you gonna go? That way and go hide in the corner? No, you're gonna go this way. Hi, my name is, can I? Now, I used to say follow you, but that sounded really creepy. So I changed it. shadow you. I changed it to shadow you. I mean, the worst they could say is no. And the answer's already no if you're standing there like a statue watching them walk by. So why not ask? And I've had nurses tell me no. And that's okay. Because for every no that I received, there were 10 yeses. And the experiences I gained from even one yes made getting every single no worth it. Your clinical experience is exactly what you make of it. If you're going to sit there and say nothing interesting happens, or my clinical site is, or my instructor is, and think of every excuse in the book, then your experience is going to be exactly what you said it is. So ignore the complainers and make the most of every opportunity and experience that you were given. Now, with nursing, nothing is beneath you as a nurse. Again, nothing is beneath you. I've answered call lights that started with a simple, "Can you please get me another blanket? I'm cold." And ended with, "Can you please go down to the OR with me? I'm scared to have this procedure." And suddenly, I'm changing into OR scrub, standing in the operating room, because I was willing to answer the call light that no one else wanted to.